think the multiple things that have changed in myeloma, it's starting with diagnosis, risk stratification, as well as use of these various drugs. So in terms of diagnosis, the new diagnostic criteria came out a couple of years ago, which had incorporated patients with smoldering myeloma who also have some biomarkers of progression or early progression, and these patients are now being considered as myeloma. So it's important to make the right diagnosis, and especially determining when to start treatment for these patients. The second important aspect is the risk stratification. We have used fish-based risk stratification for quite some time, and there is the revised ISS staging system, which incorporates the ISS staging system as well as the fish and LDH to give a better sense of patients who are not going to do well or patients who are going to do relatively well compared to the other patients. So the risk stratification is very important because that may have some implications as to what regimen you might use and what combinations or what sequence of different drugs you might use and for how long. And finally, the familiarity of using combinations is probably something that deters people in the community from using these multi-drug combinations. We know from the phase 3 trial that combining bortezomib with lenalidomide and dexamethasone clearly improves survival of these patients and should be considered the standard of care unless there's a compelling reason why they cannot get one of those two drugs. Of course, patients should always be considered for clinical trials because we are continuing to improve upon this treatment, so being able to use the newer drugs and combinations is going to be key for the future.